Okay, you're good to go.
All right, good deal. Good evening and welcome to the October 12th meeting of the Ames Community School District Board of Directors. Call the meeting to order and entertain a motion to approve the agenda.
Move to approve the agenda as presented.
Second.
Moved by Benkin, seconded by Colton. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 6-0. Director Linkaitis, will you please read the purpose statement?
Eric, could you put the first screen back up so I can see it? Sorry. The Ames Community School District commits to equity and access that empowers every individual to reach their full personal and educational potential.
Thank you very much. All right, we'll go ahead and start off with the COVID-19 report. Superintendent Reisner.
Hi, good, thank you. So the first item that we are going to cover, we said that each month we would cover the learning model enrollment update or each board meeting. So usually Christy Mixdorf, our Director of Teaching and Learning, does that, but she is not with us tonight. So Dr. Hawkins is ready to cover that.
Happy to do so. Could we click on the, perfect, thank you so much. So this is in particular an update for the board about our remote campus. You can see the first table indicates enrollment broken down by grade level and of course provides an update based upon subsequent dates. You can see in nearly every case, not every case, second grade might be the anomaly in fifth grade, but you can see in every case, numbers have risen between what they were on September and what they are in October, as far as the number of students desiring a remote campus. Then the next, I don't know, do you want me to pause for questions after each table or after the document as a whole?
I think after the document as a whole.
That's what I was taking too. Okay, so the next table really tries to outline the change or the move between the two delivery models. So you can see that as of September 23rd, we had 222 students that had requested to move to remote campus. So they were in hybrid and they requested to move to remote. And as of that same day, we had 143 that were in remote that requested to move to hybrid. Those additional numbers are the numbers that could be added to that then as of October 9th. So this just gives the board a sense of the number of students and families wishing to make changes between the models. And then the final table, if we're ready to scroll to that, just gives some comparable roster sizes between Ames remote campus rosters, which are on the far right-hand side of the table, and other school districts' remote campus rosters. So just some comparables around roster size.
And as you'll see, these are our UEN districts, most of our UEN districts.
I'm curious, do you have a sense for the movement between the remote, hybrid, and whatnot? Do you have a sense of the reasons, or have you not tracked any of that?
I do believe that there is a field in which families can explain some rationale or some reasoning there. Mm-hmm. I believe Superintendent Reisner and I spoke with our data resource or our data and assessment manager today about that. I don't have that data prepared to share with the board tonight, like some aggregate themes, but we certainly could compile those and get those back to you. So yes, we do have the information. We'd need a little time to compile the themes of those, of that particular set of information.
And I think I was just real curious on if you are tracking those themes and if that then is informing you in any of your work or the principal's work in their doing. So.
Right. You could, yeah, go ahead.
It will begin to.
Okay.
We were in, and I think Christy Mixdorf mentioned it, I believe, at the last meeting. We were in that in between stage where families were really just trying to get used to which model. So we knew we would have a lot of movement within. Now we have seen what we predicted, that there would be a little bit more stability. And so now is a really good time to begin looking at that data. So we did pull that together today, but we are not ready to, we haven't disaggregated all of it yet.
And have you seen any hopping back and forth, or families more so starting in one place and maybe moving once, but then and maybe we haven't had enough time for that, the hopping back and forth?
We wouldn't have had enough time.
Okay.
We may see that this next round,
Yeah.
but it wouldn't have been, it wouldn't have been possible because there wouldn't, it's that last, we only make those moves once a month for 2 hybrid.
Gotcha.
Superintendent Reisner, I just have a real quick question. Like, as you say, things are kind of starting to settle down. And so I know that, I guess part of what my question is, when we were talking about academic outcomes, I'm thinking, kind of before COVID hit, and we were having all these conversations about students who were not proficient and trying to make sure that we kind of weren't losing students to the gap. I'm wondering, I remember a conversation that you could identify who those students were who weren't proficient as judged by the statewide assessments. I'm wondering if things are settling down, if your administration is planning to kind of figure out where those students are physically. Are those students who are either weren't proficient last time we assessed or maybe aren't proficient now? Are they students who are hybrid? Are they remote campus? And what are the ways we're keeping track of them? Is it different? Is it the same? I'd be really curious to hear an update on that.
Great question. I will provide that for you at the next meeting, so I do a more thorough job than just giving. I'd like to show you kind of a little bit of that. That's a great question, and I will say we have some in both models, but we can definitely show you. I think that's a great question. So I will work on that for next board meeting.
Thank you.
Any other questions on that? Okay. And then the next item, we each time, as you know, we give an update on our local metrics. And this time I asked Dr. Arnold if she would go ahead and give those metrics and then talk about the CDC guidance that came out. This came out, Dr. Arnold, you might be able to help me, 3 or 4 weeks ago.
Yeah, September, mid-September.
Okay. And so we have put that together and compared it and with ours to see, are there things we can take from that or need to take from that to make ours a little more robust, or make sure that we're doing everything we can to have the best decision-making format we can. In that, so she'll talk a little bit tonight about that. I also asked her to put together some information around elementary return to learn from numbers from and models from across the nation. And so she'll speak a little bit to that as well tonight.
Sure. So just to start with our current metrics, our 14-day positivity is 7.2% with a 7-day positivity of 6.7%. Our case rate is 18.5, which represents a total of 255 new cases in Story County over the past 14 days. Our rate of transmission is now, which is that RT value, is a little bit over 1, which is higher than we saw last time at 1.06. That's a lagging indicator. It represents data from 5 days ago, but matches that slight and slow increase we've seen in both positivity and case rate over the past week or so. As far as absence data, we've been running a rate of less than 5% absences due to illness for both teachers and students across all buildings. We have had a couple positive COVID-19 test results in students and staff. However, there have been very limited close contacts identified because of our mitigation practices, like mask wearing, having smaller class sizes, which allows us to keep people 6 feet apart, and then the hybrid schedule reducing the amount of days that the children are on campus. Specific data continues to be available on our dashboard, which is updated 2 times a week on Wednesdays and Fridays. And so since we're about a little over a month into the school year, I wanted to share that recent science like Jenny just shared and guidance changes from when we developed our metrics. And that is the attachment to this. Yep, there we go. So I wanted to look first just to see what other states were doing, if there was differing guidance based upon educational level for elementary versus secondary schools. And so what you see in front of you are, for the first 3 states, Oregon, Washington State, and Wisconsin, their recommendations do have a differentiation for when to bring back PK through 5, but their metrics cutoffs are already lower than our current metrics, where we identify to bring people back at 100%. With that case rate of less than 10 per day and a positivity less than 5%. Minnesota, the following one after that, the recommendation is a slight bit higher with as far as case rate, where they bring back elementary at a case rate less than 14.7 per 100,000. Harvard Global Health, just looking outside of a state level and more of a national level, they have an initiative where they released a school guidance document with risk levels that range from green to red, with metric recommendations coupled with, they have other pandemic resilient strategies is what they call them, which include things like maintaining social distance in the classroom of 6 feet, hand hygiene, and other related factors. In their recommendations, in their orange rate, so that would be like the 3rd rate up, case rate of less than 25 per day per 100,000 is considered in that level, and includes, they do indicate that includes a risk of closures and exposures to COVID-19. The next lower category, the yellow level, matches our current recommendations for the 100% in person, where there's a case rate of less than 10 new cases daily per 100,000 population. And then finally, that CDC on the bottom, CDC finally released some metrics guidance for schools on mid-September, which helped us plan really well. But you can see their
Eric, can you
chart here.
scroll up a little bit?
Yeah, just a little. There you go. And the risk of transmission, as you can see, increases as you move further right. I added, they did not have this converted case rate per 100,000. I added that just because we're using that value and to try to give you an understanding of where that matches to our metrics. So similar to the Harvard Global Health Initiative, CDC also recommends mitigation strategies, implementing what they call their 5 key mitigation strategies to reduce risk, including consistent and correct uses of masks, social distancing, and contact tracing, among a couple others. And as a reminder, the CDC continues to recommend self-quarantine when there is a close contact exposure for COVID-19, which is not currently what Iowa IDPH recommendation is, and where theirs is if both parties are masked consistently and correctly, that self-quarantine is not required. So just also as a reminder, if you want to scroll down a little bit there, Eric, to our metrics, there we go. Our metrics serve as a guidance document in decision-making and can be impacted by additional sources of information as we learn them to allow the board to make decisions. I reviewed our metrics versus the CDC, and here's how they compare for our low category. So that's scroll back there, leave it right there. We're good. So for a positivity of less than 5% is considered lower risk, and that's consistent with the CDC's recommendation of for positivity. The case rate of less than 10% is considered in the higher risk category. But in this category, as long as we are seeing low absence rates, that corresponds to the recommendation of fully in-person school. The moderate category of a positivity of 5 to 9.9% is considered somewhere in CDC's range from a moderate to higher risk. And a case rate of 10 to 100 falls between their higher and highest risk. And that corresponds to our hybrid model, which allows us to socially distance and to mitigate through other methods too. As far as the high category, positivity of greater than 10% matches to the highest risk for the CDC. Our case rate of greater than 100 also is considered in that highest risk category. And that highest level of risks across both factors corresponds to that recommendation of 100% online learning. So our metrics are fairly consistent with CDC's guidance, although perhaps a little bit higher than risks in other states. And consistent with our general school recommendations from Iowa, that 15% closure, from looking at that, that still across the nation is much higher than any other state, that 15% as through the governor's proclamation and IDPH. The one update to our metrics, and it's not even to our metrics, but it's to how we're reporting our dashboard, is we were reporting total staff absences per building, because that gives us an understanding of our sub needs and our fills that we need for that. However, it's not clearly communicating the COVID-19 impact within that dashboard. So as of Wednesday's next update, we're going to convert the staff number. You'll see a different number completely reported on the staff. And that's going to reflect the number of COVID-19 impacts. So that includes our quarantining and positive staff in that percentage of absence. We're going to continue to track the overall building absence rate for all causes, just to look for trends and to see, identify things. But we wanted to make sure that our dashboard is clearly representing the impact of COVID-19 within the district. And I know I threw a whole bunch at you, so let me know how I can clarify anything.
Dr. Arnold, could you please repeat the number of cases that we have in Story County and in the 14?
Yes, so over the past 14 days, Story County has seen 255 new cases.
And what is our daily? You said something about 18 cases.
18 is if you take that, and that's the daily rate, is 18.5 averaged for the 14 days.
Okay, and I am wondering, you mentioned about the guidelines that Iowa Public Health has, and versus the ones. So we have two sets of guidelines, right? So what are we having our staff do?
All right, so the new guidance regarding for mask wearing or for close contact, self-quarantine, when masks are worn by both parties, how we're handling that is we are providing the parents or staff, depending on who it is in the situation, the information that from the IDPH as well as the CDC, and we're allowing them to make the choice. We still are contact tracing and looking to see if we have any close contacts, because no matter what, those close contacts should still be self-monitoring for any symptoms of COVID-19. So that has not changed our practice on contact tracing at all. It's just the guidance on if we're going to recommend that they self-quarantine or not. And we do that, leave that option to them, providing them the information from both the IDPH and CDC. And just as a reminder, those are children or staff who are not ill, but they're people who would have been in close contact but are not symptomatic or anything like that.
Are we keeping track of, we haven't had many cases, but are we thinking about keeping track of what route people take?
Yes, we haven't had a situation where the option had to be given yet, But we have had, we have had positive cases and we have had close contacts, but we have not had that situation. But yes, that will be tracked as well.
Thank you.
Mhm.
And thus far, have all of our exposures been able to be tracked outside of the school, or is that not trackable?
For a majority of our quarantines, those have been connected to cases outside of the school. We do have a limited number of close contacts that were identified through one exposure, but that was more out of our preponderance of caution, and it's because masks were not consistently and correctly worn in that situation.
So to clarify on that a little bit, as far as we know, we haven't seen any spread within the school district itself, correct? I mean, that's the big thing we've always talked about with safety, is the primary point of everything we're doing is to make it so teachers, staff, and students don't risk spreading it within the school environment. And we have not seen anything that would lead us to believe that, right?
Correct. We have had no cases where it has been related to a specific exposure in the school. No positive cases where that has occurred. And that's because, of the ability currently to keep kids and staff socially distanced at this point.
Okay. Did you have any thoughts on any of the CDC's secondary indicators? Because, I mean, one thing we had, right, is one of our secondary indicators have been looking extremely good throughout. I was kind of surprised they didn't have some other secondary indicators, but.
So for their secondary indicators, they're predominant. So there's a couple that, I do plan to look at. Some of them are more challenging for us to access. And I can provide where we are at with that for the next meeting. The hospital indicators may not be as easy for us to access. Those are some of the recommended primary indicators from the CDC, but the directionality of positive cases and case rate and some other things, the other two indicators are some things that we can look at, as part of that decision making without changing our matrix or our metrics currently, but definitely as pieces to that decision making puzzle.
One in particular that caught my eye, because I think it's the type of thing that in Ames, really when we went fully online, it's the one that we were looking at, was the localized community public setting COVID outbreak, right? I mean, that's one for us definitely to watch, because if there's a big public outbreak, that kind of is an indicator all its own. But agreed with you on the hospital ones, especially here in Ames. Mary Greeley is serving COVID patients from many, many counties, and just because they might have limited beds doesn't mean the region does. So that one's a very difficult one to make choices on.
Right, and it's also the only other is data access on the outbreaks as well. It's what do we have access to, but definitely it is an important indicator.
One other question, and I know is a tough question. I've looked myself in the past. There's no specific information you found in your research to find any true comparable towns to ours, as far as, a college area where half our residents are, within the age range that COVID is spreading more than anywhere else. I mean,
it's hard to find that published in an easy to compare form for town size and for universities. When I was looking through the guidance by states, the Wisconsin guidance is specifically from Dane County, which is where Madison is. And so that is obviously that much larger population setting, but as far as their guidance, but I can look further and see if we can find specific comparable metrics with other similar sized university towns.
Well, then I'm not necessarily asking for any specific action. It was more that I know I had myself searched several weeks ago, and I agreed there's nothing where you can really find it. I mean, it'd have to be somewhere like Lincoln or Manhattan, Kansas, or somewhere else that's, where half the community is the college. So thank you.
Yeah, and the problem is also just comparable metrics and whether or not they're publicly reporting them, which is still not very consistent when you're trying to look at that data.
Any other questions for Kathy?
I guess maybe one other question I have, Kathy, that's not necessarily related to this is not necessarily related to the metrics, but in your work that you do, have there been any studies? I feel like I saw one a few weeks ago, and I know there was one, we had an article sent to us by a couple people today, but have there been any studies that you had looked at that looked at the spread or confirmed exposures within schools that are face-to-face? So is anyone collecting that data in a broad spectrum to better inform school districts as they're working through the different decisions they're making?
I'm sure that someone is. I haven't found yet. I'm not saying it's not there, but I haven't found a reliable resource for that yet. But I definitely look at articles on a daily basis, trying to look at what's out there. And Mass General has a great compendium resource that has, they look every day and try to compile that. So I review that. But I'm sure it's out there. The problem with all of this related to COVID is things are moving so fast, and getting the information out there from a reliable source that can be validated is still yet a challenge.
Sure. Well, and we're, some school districts maybe 8 weeks into their semesters. So pulling that information together, I just wondered any of those lessons that maybe have been learned but are looking at in terms of data collection. So thanks.
Mm-hmm.
Right. Last call. Any other questions? All right.
Not a question, but I'll just make a comment because I know there's some staff on the line. And thank you for all the work you've done with the mitigation practices in the school building. I mean, that just knowing that we know that we don't think any spreads happen there. I mean, that's not by accident. That's a lot of hard work. So thank you to all the staff that put that together and are tracking that. And, the building principals are working a lot to make sure that stays that way. So thank you from the community and us.
Right. And then the last item is the COVID expenditures. And I'm going to look and see if Chris is up. She is on.
I'm here, but
All
I'm just going to warn really quickly. They're digging next door to install MetroNet for one of my neighbors, and it seems to be affecting my internet tonight. So go away. It's not personal. Eric, if you could open the attachment, that'd be great. I believe I presented data. We weren't very far into the year, and I presented the types of things that we were actually buying. That wasn't really a way to keep track of this. So instead, I'm just keeping track of expenditures by building for each month. We've still been buying the same things, PPE, things to get ready for return to learn, still some staff salaries related to return to learn. Between the general fund and Pebble to date, we have spent $222,000 related to COVID that we've been tracking. I believe that we will be turning in I will be turning in a request to FEMA for about $116,000. One thing that will change on this is I've learned since Friday that the state had actually waived the 15% requirement for the local share, and they're covering that. So it'd be 75 state and 75 75%. Responsibility on this is a little overinflated, but on the other hand, there's two very large expenditures in here that they've told me they probably will not approve. I'm going to try. So it's who that no expenditures after September 15th will be accepted any longer for FEMA. So this will be our one and only claim. Is there any questions that you might have?
Thank you so much for putting this together. I think you got cut off, or I must have missed it. How much was it that you were sending to FEMA?
It'll be about 116,000. The only thing that 99,000. That's because I still had this. When I did this report, I assumed what it was going to be originally, which was 75% federal, 10% state, and 15% local. But because of the CARES money, the state is going to cover the local portion up through those expenditures through 9/15. So we should get about 116,000 total. So that would be about 10,000 more than what's shown here. But on the other hand, like I said, there's two large expenditures, one being the masks for students and the other being plexiglass for the table, the high school, that total about 25,000 that they said they might not cover. So.
Did you get a reason? Why would that?
They have determined that anything that is considered return to low, it's a response to having children or students back in our buildings. So the way they're looking at it is anything that without the students being there would be covered. Now I'm talking to some of the other school districts that filed earlier in the summer. Some of those things were covered, so I'm going to try it and we'll see what they say.
Chris, I'm just looking through the numbers and trying to see how the sums and the subtotals look. What's the second line of Pebble? What's the difference in the two lines of Pebble? I think I understand every other line.
So the 209,000, if you look in the total, is out of general fund for a total of 222,000 total.
Okay, so only 13,000 out of Pebble. Got it. Okay.
Right. Basically, the backpack sprayers for disinfecting is the only thing that we've spent out of Pebble that will qualify.
So Chris is frozen, but what she said was that will qualify.
Be able to get them is the touchless hand sanitizers. So we bought a whole bunch of sanitizer that will be covered, that bottles of it, but we're not going to be able to get those touchless machines covered under Pebble, and those have not come in yet.
Great, thank you.
And just a quick question, because we have each building and then we have district-wide. What is like that 33,000? What is something that it would be district-wide?
We charge the staff masks to district-wide because that was just one order to Sigler. I'd have to pull up the source documents to tell you. We had some plexiglass that was for the ad building, for the maintenance building. The Pebble, those backpack sprayers were in the district-wide column.
We did
if you want more specific.
We did masks and shields. I'm guessing that some of the shields could be in there too.
Yeah, the shields, I think, yeah, they may have gotten charged district-wide. So, but the shields were a fairly small expense compared to the masks. I could look, if you're interested, I can pull up my source document and tell you more, but those were the main things.
That's okay. I just was curious to see what was versus district-wide in each building. So thank you. That's good.
I guess something I'd be interested in seeing in a future meeting, it doesn't have to be right away, but it's the big number for us, is any sort of rough projection of what this might look like for the entire year and how that's going to impact our actual budget this year. Because I mean, it looks like these numbers could continue getting larger, right?
Right, and
Just an idea
especially,
of that. And I know it'll be a rough guess, but
Yeah, I would say the
especially,
bulk is already purchased.
okay,
The main expense that's left are those touchless hand sanitizers that'll be out of Pebble. And then so that's the main one. Most of the masks were cloth masks. I mean, we bought some disposables, but the biggest expense on the masks were cloth, so those shouldn't be repeated. And a lot of the salaries that we paid to date were return to learn salaries for the plan for the teachers that we paid over the summer, so that won't be repeated. I'm sorry, Director Colton, I think I interrupted you.
no, I was thinking, thank you for that answer. No, you're good. I was thinking about what Director Beerbaum was saying, because if I heard you right, we can't build anything after September 15th. Is that correct? So that kind of gave me pause.
Yes, to FEMA.
To FEMA.
We'll still be able
Okay.
to go to the school budget review committee to get spending authority, I hope, for the stuff that's not reimbursed by FEMA. But FEMA put out a notice the end of August that said that they're changing direction on this health disaster to focus on health facilities. And so they're going to cut off anything that aren't hospitals or healthcare facilities after September 15th.
Thank you.
I do not see Superintendent Reisner on my screen. Jenny, if you're here, say something. Okay. It must be a night for internet issues. So are there any other questions for Chris about the COVID-19 expenditures? All right, seeing none, I will go ahead and Dr. Hawkins, if you're on, maybe if there are any, okay, just so that we have district representation. How's that? As I'm sure Superintendent Reisner is working to get back on, but we will go ahead and open it for comments from attendees of the meeting. And I will first read our statement regarding public.
Sorry, Elisa, can I ask one more question on the COVID-19?
Yeah, absolutely. I'm sorry, I should have opened that for other questions. Go ahead.
That's okay. So, because my question isn't really covered under any of the things that are listed there.
Sure.
But I was curious, and Dr. Hawkins, I don't know if you can answer this. Last board meeting, it was mentioned that there was a thought exchange that went out to the teacher. And I was wondering if there are results from that, or when those might be made available.
Yes, I'd be happy to speak to that. And yes, there have the feedback from staff has been analyzed. Superintendent Reisner and I believe Ms. Mixdorf met with our elementary principals. That happened to be the week that I was out. Met with our elementary principals and identified several strategies that could be used to address the concerns that we were hearing, or the feedback of teachers about how to kind of make the instructional delivery in this model work well for them. From the conversations I have had with elementary principals this week, I'm hearing positive feedback from them that those strategies are working and staff are feeling heard, and there's a sense of relief from some of those expectations. Superintendent Reisner and I met this afternoon with Dr. Nyberg from the high school to look at the thought exchange feedback from her staff, and have started to brainstorm. Actually, she's asked me to do some work on some possible options in response to that feedback. And she and I have an appointment with Mr. Michael tomorrow to meet about midday to process the feedback of the middle school team. So that's kind of the status of that feedback and of the action steps.
Thank you so much. I appreciate that.
Yep, you're very welcome.
I saw Superintendent Reisner, but now she has disappeared again. There she is.
All right.
I'm here. I apologize. Yes, he did a great job answering. So I there's nothing really more to add. I'm getting on my computer again, so there'll be just a little bit of a switch over here. But we did meet with the elementary principals, and we made some changes to relieve some of the stressors that were going on, and that seems to have helped a little bit. And again, we're looking for some ways I guess to put some strategies in place that might help relieve some of the load on the secondary teachers now with their feedback. I can't say that we're gonna totally do that. I mean, we're doing our best to make adjustments and be responsive. And so our hope is that we'll find some ways that we can do that. But we are looking at other changes as well that might have to do with trying to gain back some time on Wednesdays and still be in compliance to give teachers some more planning.
Thank you.
Any other questions? Thank you for that question, Director Shields Cook. I was going to ask her at the end, so I appreciate that you got that question in. Thank you. All right, I will go ahead and read our statement on public comments. Residents of the district, students attending the district, parents or guardians of students attending the district, and district staff members may address the board about any topic relevant to the district, whether on the current agenda or not. Those who wish to speak must sign up at the beginning of the meeting. Speaker participation is limited to 3 minutes once per item. The views and opinions of citizens addressing the board do not necessarily reflect those of the board, district administration, or staff. Speakers are to remember that Iowa law prohibits the board from discussing specific employees, students, or their performance. Student speakers will state their name and school. Others will state their name and address. And just as a reminder, this is an opportunity for any of our attendees to provide a comment or question on any of the COVID-19 items. Just raise your hand. Eric will give you permission to speak, and I will call on you. So if anyone would like to speak from the public on COVID-19, go ahead and raise your hand, please. All right, Eric, I am not seeing anybody raising their hand. Are you? Oh, okay. I saw a hand, but then it went down. I'll wait just a second to make sure if that person wanted to raise their hand and speak. Yes, Kira and Eric, can you maybe?
Sorry, Kira, if you could put your hand up one more time. There we go.
All right, if you go ahead and unmute, you've been given permission to talk. Are you there, Kira? All right, why don't we, oh, you're now mute. Can you try to unmute? All right, why don't we move to discussion items? And Kira, if we're not, maybe if you can unraise your hand and then raise it again. Okay, now see if we can get her. You've been given permission to talk. All right, maybe what we can do, if Kira would like to speak, how about we'll go on to our discussion items, but we have a public forum coming up, and maybe that would give you an opportunity maybe to log back into the meeting. So the first discussion item is policies for discussion.
All right, and I will just give a quick update or rundown on these policies and then see if anybody has any questions. So the policy committee met on October 1st, and we have brought 3 policies to the board for review. We reviewed policy 403.3, communicable diseases employees. And we recommend, the policy committee recommends replacing the current policy language with IASB's model policy. That's just given that it has been updated and vetted given our current circumstances. So the recommendation is to adopt IASB's model policy for that one. 414.2, support staff leaves and absences. Director of Human Resources, Kristen Johnson, recommended updating this one by removing the language on adoption because it was covered under FMLA, so it doesn't need to be repeated in the policy. She had recommended adding some language about prorated balances of leave when an employee is hired mid-year, and then modified the language around payment for jury duty. So those are the changes on that one. 902.2, news conferences and interviews / school-sponsored information media. The current policy is primarily based around the district's use of public access channel 7, which we no longer are using. So the committee recommends rescinding the current policy and replacing it with IASB's model policy. Are there any questions from the board?
All right, seeing none, I will open it up to comment from the public on the policies for discussion is what we are taking comments on. So the 3 policies that Director Shields Cook just went through. Again, raise your hand and Eric will provide you. And I see a hand. So Kira Werstein, I'm just going to make sure that it's your comment is on these policies for discussion. And Eric has given you permission to talk.
Can you hear me now?
Yes, yes, we can hear you.
Great, thank you. And so I was trying to switch computers here, and I wanted to make sure I'm still on the appropriate topic. So you said that
it's okay. We've got you on, so we will go with it. It is a night for connection issues, so it's just continuing with all of us. So go ahead and give your name and address, and go ahead and give us your comments.
Yes, my name is Kira Werstein. My address is 2516 Camden Drive in Ames. My kids attend Fellows Elementary School. And so I guess my questions are just because I'm hearing lots of data, and I'm glad to hear that. What I'm trying to understand is where with Dr. Arnold's choice of schools and comparisons, why she decided those select schools and not perhaps the ones that are already in our county that have the same county positivity rates and have seen success in their schools, why we would not use those as a comparison. We also have other schools in Iowa that like Waukee, which is a similar size to our community and our school district, that have had success with their mitigation strategies. And so I was curious why we wouldn't use those as comparison schools.
Okay, do you have any other questions?
If you could help clarify for parents as well, what it is that it is not clear to us as parents, what you're looking for in order to return and allow parents an option of 100% of face-to-face instruction. It's unclear for us, and it's I think it would help diffuse a lot if that would be more clear.
Okay, thank you. Did you have any other questions?
I was also, yeah, so my
Okay.
last question, just from what was discussed today, Dr. Arnold said that the absences are being counted and all absences. My concern with that, the way she stated it, is that then we would have a more full understanding of the effects of COVID-19. And my concern with that is that she's making an assumption that all absences are due to COVID-19 and even quarantined absences, and which there are lots of reasons that there could be absences. So it seems to be making a leap with that assumption.
Okay, any other questions?
That would be helpful to just start with those questions.
Okay,
Yeah,
and I can, okay, you bet. Thank you. And we're glad that we were able to connect with you. And I see Superintendent Reisner writing down your questions. So we will, if not have an opportunity later on, we will try to get those answered in the future. So the discussion items, any other comments on the policies for discussion from the members of the public? Seeing none, we'll go ahead and move on to the board committee update. Any updates anybody wants to provide? We've got facilities committee, equity committee, and policy committee. Which policy committee? We already got that review on the policies. Anything from facilities or equity?
The facilities committee met, and it was a meeting very similar to the previous one, a lot of the same topics. Some, like the Firm and Aquatic Parking MOU, are coming up later on in the meeting. I'm sure everybody's seen the stuff about the high school construction being on schedule and moving forward very well. The one I would bring up, just because it might not get noticed easily, but is an important thing that staff continues to work on, is the lighting of the path for the path that students would be walking on during the winter from Firm and Aquatic up to the high school. There's a topic later on for a conflict waiver, or a waiver of conflict for the legal firm, but that's to allow us to get this partnership, I would call it, with the city, so that we could make sure to have that path lighted and try to have it lit long-term as well, which would be great for our students.
Anything from equity? Or, sorry, questions for facilities. I saw Monique.
No, I'm trying to figure out where my mute button is.
It is a night right here.
If there are questions for facilities, please go ahead.
Okay. Any questions for facilities? Okay, you're on, Monique. Go ahead.
Okay, so for the equity committee, I hope that people have read the minutes that are in the update. I think probably what I would like to point out is that because we're working on SROs in the school, and this is a decision that really involves principal voice. And so for this issue, at least, Superintendent Reisner asked the principals if any of them would be interested in joining the committee to kind of help us navigate and work through this. And so the equity committee will be welcoming Dr. Nyberg, Principal Michael, and Principal Colvin as we continue to work through the rationale and purpose of having SROs in our school.
Thank you for getting that principal voice. I appreciated that when I read the minutes earlier, and appreciate all of you taking a look at this and trying to provide us with some additional information in our district. So thank you for making those efforts for us.
Yeah, I want to, just a quick clarification. So then because I see that you're going to be doing lots of work, and thank you for that. So what is the end, what would it be brought to the board? Would you be bringing an recommendation? That's the part that I just need a little bit clarification.
So we don't know yet. I think what we do know is that when we sat down and we had kind of this big, long idea of this kind of evidence-based research project that we wanted to undertake, we decided to sit down and say, hey, maybe we need to get the principal voice, because if all the principals have consensus about not wanting the SROs in our school, then, the board, I don't believe, would force it on them. And so we administered a survey to the principals, and kind of we're just all over the place in terms of understanding and preferences. And so we're kind of going back to square one and back to this methodical understanding. And so I think just as a district, what we're trying to do is get an understanding as a board and as a district, what is the rationale for having these particular people in our schools, and what are the ways we want to be using them, and what are the ways in which we're collecting data to be sure that we're doing it in a way that's equitable. So some of those things might come to the board. I would imagine most of them will, but some might not. So it's really, really just trying to get a rationale going at this point.
Thank you.
Any other questions? And I did see that there is teaching and learning scheduled for the end of the month, as well as another equity committee meeting. So, all right, any comments from the public on the board committee update? All right, seeing none, we will go ahead and open the public forum. If you would like to speak, please raise your hand on anything. I'm trying to give just a little bit longer wait time since we've had a few complications with technology tonight. All right, seeing none, I will go ahead and move on to the consent agenda, and I'll entertain a motion.
I move we approve the consent agenda as presented.
Second.
Moved by Bankin, seconded by Shields Cook. Superintendent Reisner.
Thank you. Doug McDermott, care of Omaha Community Foundation, Burke Family Donation, Amcor Plastics, Anonymous, Benjamin Gibson, ISU Women's Club Stitchery Group, Daniel Cam, Lisa Paulson in honor of Wayne Hank Hansen, and Marilyn Irwin in honor of Mary Lou Bryan.
All right, been moved by Bankin, seconded by Shields Cook. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 6-0. We'll move on to action items. First item is the Blackboard mass notification system.
I move the board approve the contract with Blackboard as presented.
Second.
Moved by Shields Cook, seconded by Bankin. Discussion? Seeing none, all those in favor indicate, oh, sorry, I see you, Michelle. Thank you for waving. Go ahead.
I just had a quick question. If someone could explain, is this the right one? Is this where it's going to be better at sending messages through Infinite Campus? Can someone explain that just briefly? How it will improve?
Yeah, well, a variety of ways. So this is Blackboard mass notification system. So this will actually replace the messaging part of Infinite Campus. Currently, our messages go out through Infinite Campus, but as good as Infinite Campus is as a database, it has some limitations when it comes to messaging. And so this mass notification system, it integrates with Infinite Campus. And then there's a couple other boxes that we wanted to check when we were looking at what to use. One of which was increased aesthetics, and then another was translation services. And so this is going to make that process a lot more efficient for us.
So would families be receiving messages from Infinite Campus and Blackboard Mass Media, or just Blackboard Mass
No,
Media?
so what this Blackboard does is that it pulls information from Infinite Campus, which is where we have all of our student information, and then we would send messages from this system. And so this would replace just the messaging component of Infinite Campus. But the reason why we needed it to integrate with Infinite Campus is so that we don't have to keep redundant systems as far as email addresses, so that when we update Infinite Campus as far as parent contacts, then that gets pulled into this system.
Thanks for the explanation.
All right, it's been moved by Shields Cook, seconded by Benkin. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 6-0. Item B, proceedings to approve the sale of our general obligation bond series 2020A. And we will do 4 separate motions. So we'll just take each one at a time.
And they are roll call too.
Yep. Yes. Thank you for making sure I saw that. Yep. So I'll entertain number 1.
I move to adopt the resolution appointing UMB Bank, N.A. of West Des Moines, Iowa to serve as paying agent, bond registrar, and transfer agent, approving the paying agent, bond registrar, and transfer agent, approving the paying agent, bond registrar, and transfer agent agreement, and authorizing the execution of same.
Second.
Moved by Lenkaitis, seconded by Shields Cook. Discussion? Chris, do you want to do one description for the whole thing here? Then maybe that would be the most efficient.
Sure. So this is the last actions that we'll have on issuing the new revenue bonds. So the district doesn't, and no district manages its own bonds as far as payments, and making sure that all the bond holders and stuff are paid interest and principal on time and all those things. So we're appointing UMB Bank, which used to be Bankers Trust. They've always been our paying agent. The bonds are tax exempt, so you need to approve the tax exempt certificate. There are continuing disclosure requirements. In other words, we have to tell the market certain types of things each year. The main one being that we have to give them our audit each year, but there's also significant events that might happen that we have to provide to the market. So you have to approve the continuing disclosure certificate. And then the last one is just approving the actual issuance of the bonds.
Thank you, Chris, for that information. Any other questions or discussion? All right, so I have it moved by Shields Cook, moved by Lenkaitis, seconded by Shields Cook, and I will say your name as you appear on my screen. Director Colton.
Aye.
Lenkaitis.
Aye.
Benkin.
Aye.
Shields Cook.
Aye.
Beerbaum.
Aye.
Franzen, aye. Passes 6-0. Second motion.
I move to approve the form of the tax exemption certificate.
Second.
Moved by Shields Cook, seconded by Colton. Discussion? Voting by roll call. Colton.
Aye.
Lenkaitis.
Aye.
Benkin.
Aye.
Shields Cook.
Aye.
Beerbaum.
Aye.
Franzen, aye. Passes 6-0. Number 3.
I move to adopt the resolution authorizing and providing for the terms of issuance and securing the payment of $9,855,000 school infrastructure sales and services and use tax revenue bonds, Series 2020A qualified 501c3 bonds of the Ames Community School District, State of Iowa, under the provisions of Chapter 423E and 423F of the Code of Iowa, and providing for a method of payment of said bonds.
Second.
Moved by Shields Cook, seconded by Colton. Discussion? All right, vote by roll call. Colton.
Aye.
Lenkaitis.
Aye.
Benkin.
Aye.
Shields Cook.
Aye.
Beerbaum.
Aye.
Franzen, aye. Passes 6-0. And I think I need to do
Yeah.
motion number 3,
I
right?
move.
Thank you.
I move to approve the form of the continuing disclosure certificate.
Second.
Moved by Beerbaum, seconded by Lenkaitis. Discussion? Vote by roll call. Colton,
Aye.
Linkaitis,
Aye.
Bankin,
Aye.
Shields Cook,
Aye.
Beerbaum,
Aye.
Franzen, aye. Passes 6-0. Moving on to item C, the resolution to reimburse expenditures previously spent on the pool portion of the new high school.
I move the board approve the resolution declaring an official intent under Treasury Regulation 1.150-2 to issue debt to reimburse the Ames Community School District for certain original expenditures paid in connection with specified projects.
Second.
Moved by Shields Cook, seconded by Beerbaum. Discussion.
So on the pool in particular, if you remember, we just issued 501.
We just lost you, Chris. I know what you were going to start to say.
Forward. So we don't usually have this type of motion, but we needed to on this project.
Chris, I'm going to ask you, can you repeat that because you froze, so we lost your audio.
Yeah, it said my internet was unstable. Sorry about that. The pool project is 15 million. We have spent 6 million to date because we're issuing basically 10 millions of bonds. We have to do this motion to reimburse ourselves for construction projects or construction expenditures that happened within the last 90 days or any design and engineering costs. So
thank you. Any questions? Seeing none, we have a roll call vote. Colton,
Aye.
Linkaitis,
Aye.
Bankin,
Aye.
Shields Cook,
Aye.
Beerbaum,
Aye.
Franzen, aye. Passes 6-0. Item D, MOU with City of Ames for the use of the Furman Aquatics parking lot.
I move the
I
board.
move the board.
You can take it, Alan.
I move the board approve the memorandum of understanding between the Ames Community School District and the City of Ames, Iowa for the use of Furman Aquatics Center parking lot.
Second.
Moved by Beerbaum, seconded by Bankin. Discussion. Seeing none, all those in favor indicate by saying aye.
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 Nay. Passes 6-0. Item E, waiver of conflict of interest.
I move the board approve the waiver of conflict of interest with Allers, Cooney, PC, the City of Ames, and Iowa State University perform legal work regarding a 28E agreement for the installation of lights on the bike path between Furman Aquatic Center and Ames High School.
Second.
Moved by Linkaitis. Who said, was that Shields Cook? No, Colton, was that you that said second? I'm sorry, I looked down. All right, discussion. All those in favor indicate by saying aye.
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 Opposed, nay. Do we have Bankin on here?
Yep.
Okay, I just didn't see. I just wanted to make sure we had a 6-0. Thank you. Okay, passes
Aye is
6.
back.
Okay, but you voted yay, so but passes 6-0.
Correct.
Okay. Sorry, I watched facial expressions as well as listening to you. Okay, item F, policies for action. I'll entertain a motion.
I move the board approve the policies as presented.
Second.
Moved by Shields Cook, seconded by Linkaitis. Discussion. All those in favor indicate by saying aye.
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 Pass, nay. Passes 6-0. All right, items from the board and the staff. Board members.
I just wanted to take a minute to remember Hank Hansen, who was noted that someone had donated to the Ames High Theater Department in his honor. He was a longtime theater and speech teacher and made a tremendous impact on many lives. So I just wanted to recognize him and say that we are thinking of his family in his loss.
Thank you for mentioning that. There was a nice article or a letter to the editor in the newspaper. So we certainly appreciate former students calling attention to the impact that our staff members make on their lives, because he clearly had an impact on some students. So I would just say the generosity of donors tonight, how much we appreciate. It is, I think it is very affirming when you see alumni giving back to their school in such generous ways. Clearly, our high school, our school district, but our high school in the final 4 years impacts individuals. So very nice to see that. Any other items from the board? All right, Superintendent Reisner.
I just wanted to give you an update. We have, I believe last meeting and maybe even the meeting before, we have just briefly touched on, when we begin planning and how we begin planning for a face-to-face return, and what that might look like. And, we did talk a little bit as an admin, well, not a little bit, we've talked a lot, about the data behind the return to learn for elementary students and how that works. One of the things that I really wanted to make sure that I did was prepare the best information set that I possibly could, seeing where our current metrics are and our decision-making guide. I feel like we have adopted that guidelines, and we use it for helping us make these decisions. And as we were seeing the positivity rate continue to decline, that's when I began thinking, okay, would we start planning now? Not that we're there yet, not that we meet the metrics or not that we're ready, but would we start planning now for that return to learn face to face so that we're ready? That is where we're at right now. We are in just some planning phases, putting data together, I know the board will have lots of questions. I know our teachers will have input. We want to have parent input that we collect. And so putting all that together in kind of an executive summary for the board, so that when that time comes, that we have that plan ready to go. Notice I said when that time comes, because I'm hopeful that we'll begin seeing that decline again that we were experiencing. I wish today I could say to you, I have a plan ready to go, but I don't, because we just have lots more work to do. We did send, or I should say our union sent out a survey to the staff, or to their union members. That went out on Friday, and I'm hopeful that we'll be able to meet midweek so that they can share the staff thoughts around that. What I'm really interested in at this point is finding ways to help our teachers in this time where they're feeling swamped, and how we can best support them. And I know, one of the difficulties is the teachers and people gave input, but they gave input and took votes back when on what model to be in, back when, they thought they were going to have a Wednesday day off in the middle of the week. And so once we found out that wasn't going to, when the new proclamation came out and we found out that wasn't going to meet that need, our teachers are feeling that push. And so we are doing everything we can to explore ways that we could bring back some time for staff on Wednesdays, whether it's a half day or whether we could possibly adjust some things and make it a full day. So those are some ways that we feel like we could help staff have that time that they need to plan for a whole different model of learning in addition to what they're doing, and still reaching out to students. So right now we're really focused on trying to do that, and working with the union and looking, down the road at if the data continues to decline. Now, right now it isn't, we're back on an uptick. But if the data continues to show a decline at some point and we get within that range of our decision-making guidelines, we would have this ready to bring to the board. But I do want to provide that summary for you ahead of time so that you have plenty of time to think through it, ask questions, send us back to the drawing board, because the difficulty comes if we get those questions a week before we need to go into, or we're hopeful that we're going into a face-to-face. So having the time to sort through those questions and make changes, I think is really where we want to be. So we're trying to be very proactive as we explore this and move forward. The other thing I wanted to bring up was just a reminder for the board. And I know there's so much that's happened over, even the last 2 or 3 months. But if you remember, we had worked extensively with our staff to develop a phenomenal return to learn plan that had many options to it. I truly believe it was one of the best in the state. We then took that for approval. We were approved for that plan on July 1st, and then the rules changed. And so we did go back to the drawing board. We went back, included staff, and redid plans all over again. And so I want to be mindful of the fact that plans have been in place. We have had plans in place. The district has done extensive planning. So I know that some of our staff has been put in the position where they have faced maybe unfair criticism on you should have thought these things through. You should have had plans. We have had multiple plans. And I think it's really important to speak the truth. And that is the truth. You can go back, you can look at our multiple plans we have had, even when we changed course and we went with a phased in hybrid, we had detailed plans laid out that we presented way ahead of many other districts. And so I want to really commend our staff and say thank you. And I apologize that message hasn't gone out there clear enough, but we do value your work and we know the amount of work and time that was spent doing these excellent plans. So I still feel that when we look at our data, we are providing an excellent education for our students during this time. And as we go forward, I think bringing those data points to the board, and we're also watching that data to find where our gaps are and how we fill those gaps. Is this perfect? Absolutely not. Is this easy? Not at all. Are our teachers feeling stressed and overworked? Absolutely. But I think, as we go forward, finding ways to help our teachers is where we're at until we reach that point when we can bring a plan to the board that I feel like we've got questions answered. And I don't feel like I can do that today. So I'm working on it. We're working on it. And since this is an agenda item, just as a reminder, you as the board can ask me questions. So I know you probably have some, but because it's an item on here, I just want to clarify that. You don't have to say quiet. You can ask me questions.
No, I had a piece of paper over my mute button, so I could not find. So I was going to say, if anybody has questions for Superintendent Reisner, because it is on the agenda.
I have a question, I guess just really a quick comment, 2 comments. I do want to thank you and your staff for everything that you've been doing. It has been a tremendous effort and it's been incredibly frustrating and stressful. And I don't know how it couldn't be. So thank you for the work that you've put in. I appreciate it as a parent and as a board member. The other thing I would say is that, and I've said repeatedly, the online schooling is going very well for my family for a variety of reasons, some that I never would have anticipated. And so I'm curious, just to make the comment that if there is a way to keep this in our district, I think this actually might be something that would be beneficial to many families.
Thank you. I want to follow that up with, I have heard that from quite a number of people. So yes, we are going to be exploring that. I have shared it just briefly with my administrative team. And so we will, that is something that we've heard.
I appreciate, Superintendent Reisner, that you're going to be looking at the gaps and how you're feeling them. And I want to be careful when I'm saying that I'm appreciate not the gaps in instruction, but the gaps for our students, and where are the gaps in the learning, where are the gaps in the experiences. I know Director Bankin had asked a question earlier that I think gets at some of that, but how are we, I continue to be concerned about how are we reaching all of our students, who are we missing? What is the level of engagement that we are reaching our students? I don't know if you can measure that. I know this is a very different experience for school districts, right? So just in looking at that and how are we, even in looking at a broader picture, and I think what I've come to understand, and this was more when I was serving on the teaching and learning committee, but as I've come to understand, you really want a year's worth of, what is it, YPA, year's worth of growth? I think
AYP.
Hey, thank you. Annual, yes. So we want a year's worth of growth in our students. So how are there any ways that we can be understanding how we are doing now? How is that comparative to past years? In understanding this obviously is a situation that is very broad, has broad impacts, but how are we doing? I think that's important for us as a board to understand in our responsibility with the district.
And we just did MAP testing.
Yeah, that's what I was thinking
about. Already know.
Yep.
You all have kids, so you
Yep.
know. So we just did MAP testing, and we have some other things in place. So we will be able to give some of that reporting to the board. It might be really helpful to even have a work session where we look at different data sets and can ask questions around those.
And talking about that data set, and basically to both of my board members, fellow board members' point, I would also be interested to see the dropout rate, what is compared in the last, let's say, 2 years. I'm concerned about what might happen this year because of all the back and forth. So I would be interested to see that information as well. Thank you.
And the dropout rate is calculated at the end of the school year, but we do have indicators that we look at. So I think that would be a great way to look at the data. What are the indicators that we can look at to predict that? So I think we could definitely do that. And I want to be clear, I definitely know that we all are really worried about the level of engagement and seeing, is there, and right now, all we have is we're guessing because we're just now getting the data in. We just now have enough weeks behind us. But really looking at where those pockets of, I think, of engagement that is lacking, because we do have the ability to pull more students in. And so if we find those pockets, if we know where we're targeting, we still have that ability, because not all of our classes are at 50%. capacity. So now that being said, some, especially at secondary, I talked to a teacher that I saw their name on here tonight, so this is coming from them, but like for example, she has a class that has 17 in it. Well, that's at capacity or a little beyond, but we do have classes that may have 3 or 4 students. So finding where those students who now need the additional support and who maybe aren't performing as well in that online environment, and then how do we shift and bring those students back in to classes that maybe aren't at capacity of 50%. Let me be clear. What other question? Oh.
I was going to ask a question because I was just trying to refresh my memory. This summer, wasn't it a part of the Return to Learn that there was one of the breakout groups, I'll call it that. They did a study of the buildings on what would be, what the number could be if they could be 6 feet social distance. So you could take classroom 302 at a certain building or, whatever, and you would know what that capacity of that classroom is to achieve a 6-foot socially distant situation.
Yes, Jerry has done that for the most part for the majority of our classrooms. So he's able to tell us this is where we'd still be able to achieve 6 feet. And then we also did calculations at 4.5 feet because there was some data that, if you remember, there was some data that came out about that too. So we do have those points that we can measure. We are looking at beginning to look at IEP students and their benchmarking data and participation rates. And so we have some challenges, with understanding the participation or engagement rate in a virtual or remote environment. That presents some challenges that we're still trying to work through. Along with some of our partners. So we'll be able to have some data around that and then really hone in on specific IEP students as well that may not be performing as well.
I think one thing we need to be prepared to answer is the question that was asked tonight by a community member, but also one we've been hearing kind of in general of what is that line that when we cross, we would say we would have students or some students come back into school. Because I think just a reality we have to look at is, given the Ames community and the university, we probably are never going to hit those 2 metrics until after the university is out of session, simply because every time Iowa State changes their testing protocol, the numbers change. So for example, Iowa State announced they're going to start randomly testing students. That's going to drive positivity down and it'll drive cases up. So I think we need to, go ahead.
Oh, yeah, I was going to say, Alan, I think you were going there. I'm sorry. Is that something, that was kind of why we wanted to bring that discussion tonight about here are our metrics, here's CDC, here's other states. That was why we kind of brought that. Is there a desire from the board to maybe, this will help us go forward too. Is there a desire to maybe go back and look at those metrics and adjust them? Or it's just, we've never been through this. This is a tricky situation. And so I don't know if that is something that the board is desiring to do, to go back and adjust those.
I don't know. I've tried to slice and dice them a lot of different ways. For example, like I've looked at what are the metrics if you pull the Iowa State students out, because really there hasn't been anything in the data that shows correlation on spread. But the thing is, if you do, you still have about 10 community members per day on average.
Correct.
And the positivity rate actually goes up because ISU is the one that's over testing and the community isn't. I know you know, when you look at some of the metrics, that's why I was asking about some of the secondary indicators too, just to see what other places might be doing. Something I tried to remind myself is the primary indicator that is truly the hard indicator is, are we seeing spread within the schools? Because one thing I've got to remind myself is the goal we have is to make sure students and staff are able to be in school safely and not spread COVID while they're in school. And if we meet that, that's what all those other metrics are gearing us towards, right? So I don't know. I mean, I have also looked, and I'm sure all of us have, the local districts, and yeah, some districts like Gilbert have similar class sizes to us. They're doing very well. I think that's probably because they enforce mitigation, or mitigation is even stricter. Whereas some places like Ogden that didn't have those mitigations, that didn't have masks, they had 30% of their school out. So I don't have an easy answer there, but I think we need to, as part of what you're talking about, start thinking about what do we want to do there? Because some kids are doing great online, some kids are definitely not, and need to find a way back. And we have given parents the choice to move between hybrid and online. I don't know. I mean, some of the health professionals that have reached out have said, they think we should be going back. Others might say that we shouldn't be. So I don't know. I think it's something we need to start thinking about, though, because like you said, Superintendent Reisner, we're getting at that point where we're going to have to start making those choices.
Yes, and I feel like although those are really difficult conversations to have, we need to have them ahead of time, because we need to be able to give our teachers and give our administrators time to thoroughly work through plans. So I don't want to get into a situation where we all of a sudden make a decision and then within a week we're going to implement it. I really feel like we need to be able to give them time. So one of the thoughts I had was, do we want to have a board work session next week and just go through, here we have Kathy, or we have Dr. Arnold, who is excellent with that side of the research. We have our teaching and learning folks. We have our building principals. We have so many different experts within our own organization that if maybe we could come together and look at our metrics and develop, okay, where are we feeling like we're headed? That would be helpful for us, I think, and it might be helpful for the board.
I am seeing some heads nodding.
Just in hopes that you did want to, I maybe already sent a hold this for a board work session to my directors, but I was hopeful, but I kind of wanted to see where it went.
No, I will just say that I, of course, will go to whatever meeting y'all tell me to come to. But I think it's really important. I feel like I feel like we need to be really careful here. I think one of the things that our community has appreciated is our steadiness and the clearness of our communication. And, it didn't ever, I don't think, appear that we just, we're pulling these decisions out of thin air because we were tired of whatever, right? And so I feel like we have metrics that we have consistently said are consistent with the CDC recommendations. We just had a presentation today about how our metrics are still in alignment with CDC recommendations. And so why we would just randomly decide to change them because our metrics, which say children shouldn't be in school full-time, keep kids out of school full-time, I would need some kind of rationale for why we would do that, other than that the metrics do what they're kind of designed to do. And so I think if we're going to have that conversation as a group, I think part of what we have to realize is that we have spent months talking about our frustrations at the governor, just making up numbers and doing what she wanted and whatever. And for us to now be in that same position, I think has the potential to kind of upend our community in ways that aren't helpful. And so perhaps if what we could also do is, instead of figuring out how we want to jury rig the numbers, how we might be better able to support communities that need the support. Perhaps that's also maybe just another piece of the conversation.
It is. And I think that's what I meant when I was saying, that plan for or looking at the data of where we need to fill. And let's look at students who need more support, bringing them into classrooms to reach that capacity number, because we would have, we have a ways to go there. So I definitely feel like that's a step we can take, and that can be more immediate.
I appreciate Superintendent Reisner, what you said, though, from the standpoint of continuing to look forward. And I think that that's what the intent of this is to continue to look forward, because it is a shift to go from, if it were to be a hybrid, to full face-to-face at one of our levels. That is not something that happens quickly, is what I've heard you say, I think. And so I think that would be, I would be in favor of that discussion, so that we are ready. What we can't expect is what these numbers will do. Our positivity rate in our cases per day. We can't expect that. We can, continue to follow the data, and we will, but it may go down, it may trend down. And so then I would appreciate if we are ready and have had some discussions, and you all have helped us to understand what your plan may be.
I would echo what both directors Bankin and Franzen said. I would not be in favor of doing anything to revise our metrics. I was having the same thought process that Dr. Arnold just went through a thorough review and gave us really solid information about how our metrics compare, and they are right in line with the CDC, and they're not even among the most conservative in the nation by a long stretch. So I feel very good about our metrics, and I think it's really important that we follow those metrics unless there is a good evidence-based reason to change them. I can also appreciate having a conversation where we talk about what that face-to-face return would look like, because our positivity rate did get down to like the 6 point something at one point in the last couple of weeks. So it was, it could be something that would happen in the future. And I definitely hear you, Superintendent Reisner, that, if those numbers drastically went down, say when the students leave, I don't think that will happen, but if at the end of November, suddenly we're at 3%, it would be good to be ready to hit the ground and not add additional stress onto staff.
Exactly. Yes.
And since the question was posted, Superintendent Reisner, I will answer it. And I don't see a need. I don't have a need to revise the metrics. But I do think I agree with my fellow board members that we need to be prepared. So that's it.
So go ahead, Michelle. Sorry.
My first reaction was what everyone else is saying when you said revise them, that why would we when they're in line with the CDC? But I was agreeing to a board work session just because I think there's other issues to kind of wrap our heads around. Like if we were going to drop below 5% and think about fully returning, would we phase it in? Would we phase it in before the 5% with certain age groups? What's the research say for elementary versus secondary? Because there is some difference in thinking on for those two age groups. So that's what I was nodding to, that I thought it'd be good to have a work session for those. But no, I don't think that we should change our metrics. I think that based on what Dr. Arnold presented, we are in a very good position with how we're looking at things.
And it would be great because we are working on that executive summary to kind of answer and look at a lot of those points. And so we could bring that to begin that discussion about what would it look like when we return face to face. What are the questions that you still have, so that we can go back and answer those and work through some of those things. I just would feel really good about that. And I think our staff would too.
So one of the questions I did hear you say, Superintendent Reisner, one of the things you mentioned was making sure that you had the board members' questions answered. So if there are questions that can be answered, what I'm hearing is a board work session will be scheduled for next Monday. But what questions, I would encourage board members, as there are questions that you think about this week, obviously preferably earlier rather than later, so that Superintendent Reisner can have a little bit of time. But I think
my staff on this call are going, wait, she already gave us our assignments.
It's due what night at midnight?
Yeah.
That's what my kids do.
So we won't send all our questions Friday afternoon, but certainly as we have questions about this discussion we're going to have and the information you're putting together, that we will get them. And I would say community members that are with us, you've heard this, and if there are some questions, certainly let Superintendent Reisner know. A work session, just as a reminder, work sessions are work sessions, so there are not opportunities for public comment. There are not opportunities for public questions. So I would encourage you, if you have questions, please get them to us ahead of time, because we will not, how our meetings are set up for work sessions, we will not entertain questions at that time. So thank you, Superintendent Reisner, for that information. Any other comments from you or questions from everybody?
No, I just appreciate the discussion. It's, and just thank you for having it.
Yeah. Any other things going on in the district?
Can we, I know.
We're going to end on a positive note. We had a golfer do very well, Sam Vernon, at the state. Someone's going to have to help me because I can't remember exactly his place he ended up in.
Golf tournament.
On Saturday he did. Fifth, right? It is fifth, isn't it? Yes. Thank you, Eric. I thought it was fifth. So yes, he ended up fifth on Saturday. So we are certainly always proud in any other ways that our students are representing our school district well. You make us proud. So hats off to you. So Eric, did you have any other positive thing to add? You came up on the screen.
No, well, I was going to tell you about the fifth place, but we are also working on a story about some all-state musicians, and the way that they have to audition this year is very different than what they have in previous years. So I know a lot of choral students, they would audition in groups, and now they have to do it. They have to submit a video in order to do it, and they're singing by themselves. And so I went and visited along with our communication specialist last week. We saw a student, we actually posted it today on social media about how, they're just kind of up there and doing it. But, our band and orchestra students are doing it the same way. And as we all know, we have a very robust music department here in Ames. And so they're doing it. It's just a very different year on how they're doing it this year. So. Yes.
And my understanding is the actual festival will not happen because it is a large group, but I'm so sad for the kids because the All-State Music Festival is an amazing production. And so, but certainly glad that they're getting an opportunity to share their talents in a pretty unique way. So any other comments?
I'm glad we ended on some positive.
Exactly. Yes. Very important, right? The board planning calendar. We already went over some of the upcoming committee meetings, but like we said, we will have a board work session next Monday, potentially 5:30, maybe 6:30, but we will post that. I don't want to lay claim to the time. We'll post it later, and then we will have our regular board meeting in 2 weeks. So with that, I will entertain a motion to adjourn.
I move we
adjourn.
Does nobody want to leave? Okay, I think I heard Shields Cook with the motion, Colton with the second. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 6-0. Thank you, everyone. Have a good